Today, of course, is the Caring for Kids Radiothon for the Montreal Children's Hospital. From COVID-19 to unprecedented RSV outbreaks to the resurgence of measles, it's been quite the last few years. It's given us all an unexpected and, I guess, unwanted education, perhaps, on the importance of preventing infectious diseases, particularly in children. So joining us now to talk about what we can do to protect our kids is Dr. Jesse Papenberg. He's one of Canada's top pediatric infectious disease experts and a medical microbiologist, and he is here with us today. Dr. Papenberg, first of all, thank you not just for today, but for all the work that you do. And I would ask, and I think parents obviously are aware of this, if you have a child and your child goes to daycare, we all know how easily kids can end up spreading an infectious disease. So let's start with that. What are some of the better or best defenses we should be using to, first of all, protect the children?
Oh, thanks, Aaron. And as a parent myself, I know that it's really hard to control, what our kids are going to get exposed to in terms of potential infections when they're in daycare or preschool. It's very difficult to control that. But there are some things that we can control as parents. Some of the perhaps easier things or simpler things are, first of all, good sleep hygiene. In other words, enough sleep, good quality sleep. We know that does influence a child's immune system and can influence their risk of getting infections. Hand hygiene is another thing, and obviously our youngest children are not going to be able to follow good hand hygiene, but once they start getting a little bit older, teaching them to frequently wash their hands can help reduce the risk of infections. But most importantly is staying on top of their childhood vaccinations. We know that routine immunizations after clean drinking water are the most important intervention the public health has been able to do in terms of saving lives, in particularly children's lives under the age of 5. And our routine vaccination programs in Quebec are safe, they work, and they protect our youngest kids, which are the most vulnerable, against the most severe infectious diseases that we know, and that's really important.
So I would ask, because I know some parents in hearing this, we already know that community exists with respect to vaccinations. How effective with respect to children? Because some people may say, I don't want to do this for whatever reason. As I said, we know those people are out there. How effective are these vaccinations for children in preventing these diseases?
So the vaccines that we have are very effective at preventing the most serious infections. And in particular, as I was saying earlier, it's our youngest children often that are at most risk of getting severe infections or severe vaccine preventable diseases. So that's why it can seem counterintuitive for some people because they feel they want to protect their child so much to do something, but actually doing something, vaccinating your child is the one thing you can do that will help protect them the most against infectious diseases.
I want to go back to something else you brought up, and of course we all learned this lesson during the pandemic, this idea of doing something as simple as washing your hands with soap and water, for example. So during the course of a day or during the course of, of being in daycare, they perhaps don't get that opportunity as often as they should. What about using something like a wipe or an antibacterial liquid of some kind? Is that still effective or is that not for children?
Yeah, you can use wipes on the hands and other skin surfaces if needed. You can use the usual hand wash or the hand hygiene material, whether it be an alcohol rub or gel. Those are all very effective and considered safe in kids as well.
Okay, so you were talking now about how to prevent kids from going ahead and spreading these. What about for us, the rest of us, the grown-ups in the room? What do we do?
Well, I think that what things adults can do are include making sure that our most vulnerable adults maybe not be in contact with people who are sick. So we know that people that are at the extremes of age, so young kids, but also our elderly population, are at higher risk of getting more severe infections, especially viral infections during the winter time. So I think we want to just be a little bit careful with older people, especially those that have chronic lung or heart conditions. Make sure that their vaccines are up to date for the seasonal vaccines. So talking about influenza, COVID-19, and perhaps this year also RSV vaccines in the elderly, which are going to be new. So keeping their vaccines up to date and also making sure that we try and cocoon them a little bit and not expose them to people who have signs of a viral respiratory illness.
We're speaking with Dr. Jesse Papenberg, pediatric infectious disease specialist and medical microbiologist at the Children's, brought to you by Senville. Dr. Papenberg, with respect to what we learned from COVID, and I mentioned that right off the top, obviously, as a doctor, as a scientist, so much has been learned. I'm wondering going forward, because I mentioned off the top, beyond COVID, which we were also focused on, we ended up with something called RSV. We ended up with measles becoming an issue to deal with. So what are we learning and how are we able to prevent those now? Is this simply a matter of vaccinations across the board?
So we have learned from COVID that, or what we saw with COVID, was that our vaccine programs against COVID were instrumental in us being able to return to a more normal post-pandemic life and protecting especially those that were most at risk for severe disease, elderly, immunocompromised, people with chronic medical conditions. Vaccinations against COVID were instrumental. But I think what we learned also is that it's really important to keep an eye out for the next new virus, and I think we're increasing our awareness of that across Canada, building infrastructures and networks to try and make sure that for the next pandemic we'll be readier than we were this time, because it's not just about vaccines, obviously. It's about finding ways to decrease transmission through personal protective equipment, also making sure that the tests are available quickly and they can give you an accurate diagnosis, and also treatments as well for people who are sick. And then with regards to measles and RSV, we've known these foes for a long time. Thankfully for measles, vaccine have been implemented for decades, and measles is considered eliminated in North America. But we did get a scare with importation of cases and increased number of transmission of cases here in Quebec and elsewhere in Canada. And unfortunately, there even was a measles-associated death in Canada this year. So it reminds us how important making sure that we have good coverage for our basic immunization programs for our kids who are born here, and also for children and adults who come in from other parts of the world who maybe didn't have the opportunity to get vaccinated in their home country. And finally, I have some exciting news for RSV, which is the number one cause of hospitalization in children under the age of 1, year in, year out during the winter season. The last couple of winters after COVID, we saw huge RSV seasons because there was very little RSV that circulated initially during the pandemic with the lockdowns, and then really got hit hard with large numbers of kids going to the emergency department and getting hospitalized. But this year in Quebec, for the first time, we have a vaccine against RSV that will be available to all newborns born during the RSV season and to all infants less than 6 months of age at the start of the RSV season. And this vaccine has been shown to be not only very safe, but effective at 80% at reducing the risk of hospitalization due to RSV. This is a huge deal, and I want families who are either expecting a child to be born during the fall or winter, or will have a young child at that time, to be aware of that and to get that vaccine. One dose will protect an infant throughout the entire RSV season. It's a real game changer.
Wow, there is some great news. Dr. Papenberg, thanks so much, folks. That's why we're here today for the Caring for Kids Radiothon, to keep important work, important developments like this available to everyone. That's why we ask you to make the phones ring and continue with our donations. Dr. Papenberg, again, thanks so much for your time and for all your hard work in dealing with these great, great kids at the Children's.
Thanks, Aaron. I appreciate it.
This Children's Champion Chat has been brought to you by Senville. You can help protect vulnerable kids by joining the Circle of Hugs right now. Call the Dormez-vous phone bank at 514-939-KIDS. That's 939-5437.